Hello everyone, I'm Dr. Parsa Mohebi, a hair transplant surgeon in Los Angeles. Today I'm here to tell you everything about Jewish hair transplantation and how is it different than other types of hair transplant procedures. Well, Jewish hair transplantation could be different from average Caucasian transplantation because at times, most of the times, Jewish people have thicker and curlier hair, so that curliness of the hair sometimes becomes to the point that we see it becoming similar to African American hair, almost like the same curl. That makes it a little more difficult with FUE extraction of the grafts. Excision of the grafts is more challenging. The good news is with the current technology, with the new method of extraction like 𝘠𝘶𝘸𝘸 system, we can extract pretty much any type of hair with good quality hair, with intact hair. So I'm going to show you some pictures of the patient that we're going to do today, and you see how we're going to design it probably a little bit differently and spread the grafts or distribute the grafts a little bit differently. So as you can see, this is a typical Jewish curly hair, which sometimes this is not the curliest, but sometimes it could be even curlier than that. So this is the hairline that we designed for him. He's a class 3V going through class 4, that the whole front is thinning. So when you look at the other angles, you see the whole front of the hair is almost either going or gone. So we pretty much have to go all the way back to that area and cover the whole front. So we designed this nice irregular hairline, which is going to start with single hairs followed by 2s and 3s. The good thing is with that curly hair, although the extraction of grafts is more difficult, we can count on those hairs more. So each hair that we place, because of the curliness, and especially in this patient because of the coarseness of the hair, it gives more volume of hair to cover those areas. So if you can see this area, this is not a small area. We're planning to only put 1,400 grafts there, and for 1,400 pretty much cover the whole frontal area. We do maximum density in front, and as we go toward the back, we lower the density. And when we go toward the top and crown, this crown area is relatively big, although it's not completely bald, but we still have to cover it. So we plan to do only 800 or 900 grafts for that area, which is, for the size of the area, is not a big number. But again, because of the curliness and the thickness of the hair, it gives us a good coverage that covers the whole area of the back and top of the crown area. We do local anesthesia, so we use a combination of lidocaine, marcaine, and epinephrine to anesthetize the recipient and donor area. Usually patients are sedated, so they may not even remember that phase. After that, everything is numb. So we start making sites. We design the holes that grafts will go into. We call this step site designing or hairline designing if it's on hairline area. We decide on distribution and direction of the hair and even curvature of hair at this stage. After that, we start extracting the hair under microscope and placing them at the same time. We do simultaneous extraction and placement because we want to keep these grafts viable. We don't want the grafts to sit out of the body for a long time. So we remove them, and the placers will place them with Mohebi implanter at the same time that we remove them. There's a special device that the grafts get loaded and placed into the sites without any harm to the grafts. The last step is to clean up, put a bandage on, and patient could be discharged home. And we usually see patients the day after procedure for hair wash and just to evaluate and make sure everything is healing properly. I hope I was able to shed some light on Jewish hair transplantation and answer some of your questions. If you have more questions, make sure you put them on the comment section and we get back to them and answer them as soon as we can. Also subscribe to our YouTube channel, and you will be getting updates about the newest techniques and innovations in hair restoration procedures.